Hello, I'm Dr. Soroush Zaghi, ENT sleep surgeon, and I'm here with our in-house myofunctional therapist, Sanda Valcu-Pinkerton, at the Breathe Institute, and it's our pleasure to welcome Sarah Hornsby, online myofunctional therapist, to our practice. And so welcome, Sarah.
Thanks. I'm really happy to be here, and I really enjoyed the presentation that I got to see the other day that you were putting on. So
absolutely,
I'm glad to be a part of it.
Absolutely. So we've had the chance to learn, just work together through cases that we've had in common, and had a chance to look at some of the great videos you have. And I know it's such an amazing resource to a lot of our patients who first learn about myofunctional therapy and the importance of nasal breathing. And so it's our pleasure to invite you to our course so that you can kind of see what we do and how things are similar or different.
Yeah, I think it's great, and I'm really happy I got to meet Sanda as well and just learn from what you guys are doing compared to what I'm doing, and how we can integrate and learn from each other. So
it was great to have you in the course. The perspective that we try to share in our course, that it's not so much about the surgery, the cutting, but more about the function, the preparedness for the surgery, and the technique that we kind of encourage is more of a dissection method rather than a big cutting method. And what did you take away from our presentation?
Well, I loved seeing you guys do, or Dr. Zaghi, I loved seeing him do the procedure, and I loved seeing how Sanda was integrated and how it literally is a functional frenuloplasty. So, you're doing the small cutting, and then Sanda does the therapy and has them swallow, and to see how you guys do it together was really incredible. And to realize that it is a very small incision, and then the fascia actually separates from the muscle pretty much on its own with a little bit of encouragement from the swallowing and also from just the movement that you do with your thumb. And it's much less invasive than I could have imagined. So I kind of knew, but seeing it in person was really good.
Yeah, that's awesome. And I think one of the most important things is that patients have to be prepared with the myofunctional therapy.
Yes.
And that's one of the things that we really encourage.
Right. That is the segment we always like to highlight. It is the importance of pre-op preparation. And that's exactly to the point you are mentioning, how easily the fascia is releasing almost on its own, and sometimes on its own. That comes from the patient being prepared and using the tongue and knowing how to do exercises. That's one aspect. And the second aspect we are emphasizing a lot, it is to prepare the patient to change his or her habit in terms of jaw disassociation, neck disassociation, and being able to move the tongue on its own instead of being supported by the jaw. And that's a big factor, and that's what we like, not that people don't know, but just to highlight how important it is to be done before the surgery.
Yes.
So after the surgery, when they start to do their exercises, they will be a lot more aware how to do the exercises.
Yeah, and I think it's so important for patients to realize it's not just the frenectomy is the answer to everything. It's the function, and it's changing the habits and learning to breathe through the nose, and releasing the tongue tie is more like a means to an end. It's not like the whole point of everything, right?
Right.
And you guys are doing such a good job in a clinic getting that point across to people, and I'm trying to do that online, so
So I'm very grateful because you put a lot of information out there, and in a way make the life for everybody else, all the myofunctional therapies community, a little easier, because as we know, when the patient come not knowing what we do and they are asking us myo what, and we know we have a problem, right? Yeah. Explaining all the details and all the ramifications. So we are grateful for that part.
Thank you.
And there's a lot of great information online on what is myofunctional therapy and how to do it, but I always encourage my patients, and I require them to actually work with someone on a mentorship basis. And so what are your guys' thoughts on patients who say, I have a list of the exercises, I'm doing them, versus working with them one-on-one? Do you see differences?
Yes, I do. And the way I like to explain my patients, it is that I perceive myself as a coach. and knowing how the exercises need to be performed, that makes the difference. Because I can read anything and I think in my head that I'm following directions. However, I'm learning, not knowing what the results should be from that exercise, then I'm not aware, and I might do those exercises actually in a detrimental way. And that's so important to have guidance from someone understanding what the final scope of the exercise is.
Getting that feedback from a coach or a therapist, it's a lot like working out with a personal trainer versus just signing up for a gym membership. Like, I'm just gonna sign up for this and go in, and there's tons of machines, there's tons of things you can do in a gym. But if you're actually working with a personal trainer who can guide you through each step, give you feedback, and teach you what you're doing wrong versus what you maybe think you're doing the right way, it's so much better. And I'm sure that you see the better results from
absolutely.
From
so one of the things that I see oftentimes is people complaining of pain when they're doing the exercises because they're doing it in a maladaptive fashion, or if they're extending their neck a lot, or lifting up the floor of the mouth, or really trying hard. And the analogy that I run is that it's like trying to lift weights. And if your muscle is so weak and you just try to go to the gym and lift weights, you're going to use your whole back and everything, and then you're going to say, I went to the gym and I injured myself. That's why most exercise programs say you should do it under supervision of somebody who knows how to do that exercise.
Yeah, that's
and
cool.
So that's why I really encourage people
good analogy.
Who are going to do these exercises, yes, try to do them. But if you're having pain or you're not making progress, reach out to someone, because maybe you're not seeing it, you're not doing it adequately, you're doing it in a maladaptive fashion, and I think that's really the therapist coming to play to really point it out.
Yeah.
And I think another point it is that a therapist kind of is customizing the exercises.
Exactly.
And because if you learn that the patient has TMD's issues, then definitely you'll customize those exercises. You read an exercise, you just try to follow what you think the direction it is. So besides of being a coach, you are kind of guide the exercises. What exercises will benefit that particular patient.
It's not a one size fits all. Like,
exactly,
just do these 5 exercises and you'll be ready for your frenectomy. There's so much more to it, right?
Right.
And actually the part that I really enjoyed about your lecture was connecting the fascia, and people don't realize our tongue is connected to the whole rest of our body through a fascia system, and I think releasing the tongue tie and doing it the right way functionally can be so helpful to people. But I love that you were saying that, because
it's so important.
It's so missed too.
Yeah, and it's all one system, and it all works together, and so there's multiple different components to it, and so people have to be aware that it's just not a little piece of string underneath your tongue or just the tongue, but the tongue connects to your chest, connects to your diaphragm, all the way down to your legs through this fascia system.
Exactly.
And that's how the myofunctional, but also the physical therapy component comes into play.
And the body worker,
and the body worker, and OTs, and it's actually a totally multidisciplinary approach. But then someone needs to have that understanding. So that's we are advised, go and set up an appointment and have a consultation and establish a relationship with myofunctional therapist besides of just reading, because you might need other type of work to be done as well. Okay?
Yeah, it's like a team approach.
Exactly,
we've got the surgeon, we've got the myofunctional therapist, we've got the craniosacral therapists or osteopaths, physical therapists, dentists. So many people have to come together to help our patients get the best results.
Absolutely. So what would you guys say is the ideal patient to work with either one of you? What would you say? So someone's coming in. So this is what I do. When someone wants to come and have an evaluation with me, I don't do the surgery on the same day. I have a meeting with the patient to see what are their goals and are they willing to commit effort to achieving their goals, and to make sure that what they hope to achieve is realistic, right? Is that something that you look for when you're evaluating patients?
I do. And in evaluation patients, actually, that's a big chunk of the time I'm spending with the patient. I'm spending a lot of time in educating and showing them what are my goals, pretty much showing what what the diagnosis is, and then I explain them what are my goals with my therapy. Well, I need you to be able to disassociate your jaw. I need your tongue to be stronger. I need you to be able to do suction, because that's a very common question. How much time do I need to spend? So with me educating them, explaining them what are my goals, then I kind of, the next time when the patient comes, my first question it is, well, in your evaluation, what was your compliance? And first, I did 70%, maybe 50. Okay, so I make a note of that. And I said, okay, I mean, I'm not wagging my fingers, but then, and I said, well, let's see, can the exercise without moving your jaw? Not really. So at that point, I feel like they start to own their problems,
Yes.
and then they will start to work more diligently. And then pretty much I say, well, listen, what do you think? Do we have 2 sessions or 1 session for us to achieve those goals? And every single time I'm repeating the goals, because I want them to know where we are going and to understand. And I found that it's really motivating, and then they will follow through.
Yeah.
And then after, I'm spending a little more time, and I explain to them, let's just bring a little more, mobility and strength in the tongue, because now it's free. However, I always emphasize we need to reevaluate. Do you need more work for the swallowing? Do you need more work for the jaw strength and disassociation? And I always make the point for them to understand. It's not like I'm doing 10 sessions and you are done, because I would mislead.
Yeah, and I think for me a big part is when patients are signing up, I really want them to be clear, like, this does take commitment, it does take some effort, it's not a lot, but you have to do a little bit every day, and if you don't think you can commit to doing a program, then I don't want to just take your money and have then I feel bad, you feel bad. I really want people to be involved and to get the point of the therapy, so that way they embrace it and they do it and they feel good doing it, versus like, oh, I have to do these exercises and I don't even understand why, and that's not what we want. We want people to be fully involved and proactive in their treatment.
Yeah.
Yes.
Yeah. We love it when patients really own their own health.
Own their own health,
Yeah.
exactly right.
Yeah.
And they know they are in charge, because usually they want to put you in charge. Well, I'm not in charge. I'm just here to guide.
Yeah.
And then you have the power to change whatever you need to be changing in your health. Right?
Yeah, and I think telling patients too, don't take my word for this. Get second opinions. Go talk to other therapists. Ask, do your research. Learn about these things. Now we have research, thanks to a lot of the stuff you've done. We've got more research that is validating the need for frenectomies and the connection to bigger things like sleep apnea and orthodontic stuff that people haven't always understood. Like, how can mouth breathing lead to malocclusion, and how do tongue ties relate to all this stuff? And so connecting those dots for people, and not just saying this is from me only.
Or
There's
I
a whole
said so.
group of people.
Right.
There's a whole group of people talking about this. Don't just take my word for
exactly
it.
Right.
So
Exactly.
That's exactly right.
Well, thank you so much for all the work that you do for creating awareness and bringing information to patients, and we're thrilled to have you here and look forward to more collaboration together.
Yeah, thank you so much. I'm so happy to be here. I'm glad I got to see your practice and learn from you guys too.